Hey everyone, I'm Mohammed Kraish. I'm a physical therapist at Mount Sinai downtown.
Why do you like treating runners? Why do you like working with runners?
I like to run. I feel like they're great patients because they want to get better. Runners are pretty.
It's spring, man. Springtime in New York. Springtime is upon us. And as things get warmer, everybody gets real motivated to get back out there. So you might have some runners returning to running outdoors, or you might have some people, you know what, lacing them up for the first time. If they're thinking, hey, I'm going to start running now that it's getting warmer, what maybe are three things I should do before I start to make my return to running a good one so I don't get hurt? What would you suggest?
The very first thing is you have to stretch. Stretching is imperative if you're going to go out, especially now in the spring, because what were you doing all winter? You were hibernating. It was cold. You obviously weren't going out, and your body is physically cold. Stretching is number one. When I say stretching, I usually say the bigger muscle groups like your quadricep is that big muscle here in your thigh. Your hamstring is the muscle in the back of your leg. Your calves are the calves are probably the number one injury we get. Number two, start getting strong, especially in your leg muscles, and particularly the glute musculature. We're not saying that you're weak. We're just saying that you're not used to using these muscles, and these are good exercises to start stimulating that. And last but not least, breathing is extremely important. So breathing exercises that I usually like to have my patients go through just to kind of get their cardiovascular fitness up before they even start doing cardiovascular fitness. Man called the Iceman, his name is Wim Hof. He's pretty famous out there. He can run you through a set of breathing exercises that I think will be very helpful to sort of get you to start running correctly.
All right, so we're off on the right foot to getting back to running with those three suggestions. Talking about feet, how would you suggest? Is there one or two things you'd tell people to look for when picking out a new running shoe?
So when it comes to running, depending on how serious you are, I always like to sort of have someone evaluated for running because there are many different running styles. Depending on what your running style is, unless you're going to need a specific shoe for that. For example, if you're a sort of more of like a runner who runs on the balls of your feet, like what we call a 4-foot runner, you might want to have something a little more minimalist, like a Nike Free or Vibram or some sort of zero shoe. Because when you're running on the balls of your feet, you inherently are going to land a little softer because you want to feel the ground. So you don't need a lot of cushion. You actually want less cushion so you can get a better feel for the ground. Now, if you're like most runners who kind of run and hit the ground with their heel on the ground, then you might want a more cushioned shoe. Like the Hokas are pretty popular for that. So there are sneakers that are extremely cushioned, especially in the back because you're hitting the ground on your heel. And then you have people who kind of just flatten out their feet every time they run. Their knee collapses in, their foot flats in. And there are sneakers that basically can control that, what we call pronation. So sneakers like the Brooks or even certain Asics, they have a dynamic control sneaker. So those are pretty much the three big types of sneakers out there. Again, it depends on what type of runner you are.
So now we know what we're putting on our feet. How about how far are we supposed to go? How do I plan out how often I should be running and how far I should be running every time I lace them up?
It all depends on your goal, right? So if your goal is to run a marathon, then there's specific protocols for that. But usually you want to sort of start off with like a long type run, which is anywhere between half a mile to 10 miles, 12 miles, whatever it is that your goal is. Then you have your sort of interval training runs where you're just doing sprint, walk, sprint, walk, sprint, walk. And that's more for your cardiovascular fitness. That's to kind of get your heart rate up and then drop it down, heart rate up. And that's more, again, to get your cardiovascular fitness. And then you have your hill training, which is usually like you run up a hill, walk down, run up a hill. And that's just to get your legs strong. So those are the three basic running training paradigms. If you set up to run the marathon in New York, that's in November. Usually around this time, that's when people start training. Those are your three big training runs. So usually you would start off with like a mile and then build up to 12 to 18 miles by October.
Big question that runners ask, right? They know they should do some stuff outside of just running? And then the topic of weightlifting comes up. So we're going to throw the question to you. How do you answer when a patient asks you, should I lift weights when planning to start running? If so, what should I be doing with weights?
So yeah, great question. The short answer is absolutely yes. You should be doing some sort of strengthening for your legs besides the hill sprints. Especially to avoid injury, it's very important to get your glutes as strong as possible because your glute is your powerhouse of your body and it protects both your back and your knee and ankle. So the stronger your glute muscles are, stable your spine will be, the more stable your whole leg will be. So we usually have patients go through a series of glute exercises like glute bridges, leg raises where you're going forward, side, back, in all three directions. That's pretty much the steeple of glute exercises. The next thing would be to work on your core. Absolutely. You want to do some sort of core type exercises. So things like, where you're sort of doing leg raises, side planks are great. Anything where you're sort of like on your hands and knees and doing opposite arm, opposite leg, hands and knees. So that's going to help get your core nice and strong because your whole body is obviously being utilized when you're running.
Final question we'll throw your way. This one comes up after people have started to take up running. If I experience pain while I'm running, what should I do? Some people say you got to stop immediately. Some people say power through it. What should I do? How do I know what's right for me?
I have a lovely saying. It's no pain, more gain. So obviously if it does, like the rule of thumb is if it hurts, I would stop. A lot of times in the military, they have a nice saying in the military, how can you tell the difference between being hurt and being injured, right? So if you're just hurt, as soon as you stop running, the pain obviously goes away. So, obviously whatever you were doing hurt, but as soon as you stop doing it, that's okay. So you're not really technically injured, right? So the definition of injury is how long does that pain linger? What's the irritability of that tissue, whatever that injury is. So if you're running and your back hurts, as soon as you stop running, if you continually have back pain, then you might be injured. Same thing with, your hamstrings. If you have a strain of your hamstring, every step you take is going to hurt. A lot of it has to do with the irritability of whatever's paining you, right? To take that in mind when you are feeling pain, if you are running. If you stop running, as the pain stops, great. You can go back to your training. If pain lingers and doesn't go away, that's when you should probably take it very seriously.
Mohammed, appreciate you taking some time out of your busy schedule with patients to talk to us about getting back to running here in the spring.
Anytime.